Welcome back. We're at the very final stages of what I think has been a really great morning and indeed afternoon. I think what the conference to date or symposium to date has highlighted is our ability to network as Irish people. We are really, really good at that. We are ambitious enough to be confident, not only within our own country, but you see Mike Dowling, Trish Scanlon, Mark Lawler, all of whom work in different healthcare service systems, being leaders in the area. And it does come back to vision, it comes back to positivity, which we need a lot of, in my opinion now, more people like us going out speaking positively to the people of the country. So I'm going to ask Sinead to begin with what she hopes to gain from Healthcare Leadership Network.
Thanks, Mary. What we as co-founders of the network would really like for the network is to have it be an influential voice within the healthcare system. That it's really been formed in the spirit of collaboration and innovation, and that we're blending management, finance, and clinical together in order to come up with innovative solutions for healthcare that may influence and drive healthcare policy going forward.
Thanks, Sinead. And Knut, I suppose one of my big bugbears always is healthcare professionals need to learn more about business. We have a limited healthcare budget. We have to use it the best way possible. So our ability to really educate ourselves and how to get the best value for money, to give the best quality healthcare for our patients. So just tell us a little bit about why you think learning about business in a healthcare environment is so important.
I think it's very easy for people to remain focused solely on their job and the mammoth task of healthcare provision, direct provision. But actually it's becoming more and more important nowadays that we advocate for our patients, not only for their services, but for funding for our services, to make business cases for why a service is needed. There's a big push for value-based healthcare, and that's only going to become more important with limited resources that we have, even more so in a post-COVID era where resources are stretched. And it's really it's important for healthcare leaders to be able to have those conversations. We come through medical school or pharmacy or physio or any of the healthcare providers, and we don't learn about business. We don't learn about organizations, and yet we're told to fit into an organizational structure or a way of being that's there now. Now, as care evolves and as our thoughts evolve, or the way we want to care for our patients evolve, we need to be able to push back a little and contribute our own ideas on how those healthcare systems should evolve rather than staying just the way it was in the past.
And the final question I'll put to both of you is, in healthcare, we're very comfortable with providing healthcare. We tend to be less comfortable engaging with our colleagues in business often. I feel we as healthcare professionals have a lot to learn from our colleagues in business, and likewise people in business have a lot to learn from healthcare provision, given that it's such a big part, as we well know now, but always is a big part of our life. So how do you propose it not just being a healthcare group, but really engaging with our peers, or your peers, you're a lot younger than me, in bringing them in so we can see the same issue from different perspectives? Knut, I'll ask you briefly to answer.
Well, I think as Larry mentioned earlier, it was really interesting that the innovators are people we need to learn from. So, and even Mike mentioned the way that people are accessing healthcare, in the 20 to 25-year-olds, they're the people we need to be listening to. So it's very easy for us to, as clinicians, to say this is how something should be done, but we need to be able to engage with business leaders. It's equally very easy for business leaders to say, well, this is how a hospital should be run, or this is how a healthcare budget should be organized. But they may not understand the nuances of healthcare provision that healthcare providers do. And so really there needs to be overlap, there needs to be collaboration, there needs to be cross-sectoral input to get really a result that's greater than the sum of its parts. And that's the idea for the network.
The final question I'll give to Sinead, and it came in from one of the audience, is what are the themes for future events?
So we have planned a number and series of events that will happen throughout the year. The next one happening in the winter season. There's a number of themes that we'll be looking into: shared learning across all the industries, cross-sector collaborations, personalised health, digital transformation, and value-based healthcare as well. But we are really looking for input from all our members in order to inform what speakers that you'd like to hear, and also what themes you'd like for these sessions.
So I'm going to ask, how do they get in touch with you practically?
So you can get in touch with a number of ways. So you can get in touch through our LinkedIn page or UCD email as well, leadershipinhealthcare@ucd.ie.
Okay, thank you very much. So to both our panelists and for their huge contribution in organising the event today. So the final wrap up, Geraldine and I are going to just have a brief, I suppose, conclusion of what I think has been a fantastic day, bringing people who are recognised nationally as leaders in so many various aspects of business, sports, the arts, healthcare, research and innovation, not only here but abroad, who've given their time. I think we've all learned in different ways, but there are a few common themes, and Geraldine, you probably picked up on some of the words, the themes that came up.
Sure, Mary. Yes, Larry and Susie really provided us with a wonderful synopsis. And certainly for me, my top three things that came out this morning, as a scientist, first and foremost, I suppose, is follow the data and the importance of data, the importance of good data, granular data, and then using that data to inform our actions, to inform our decision making, to inform our policy making. And then also, you know, in the early part of this session, and really it ran also throughout the morning, was the importance of research and innovation, very much linking in with that data. Secondly, I suppose, what really struck me was with regard to how in our healthcare system and in managing and organising our healthcare system during the pandemic, we've been thrust into making huge changes very rapidly in our processes. And Alan spoke very well to that, is as an example in the Mater Hospital. Having made those changes within our processes very rapidly tells us that we really can change the way in which we do things, the way in which we deliver care, and the process in which we do that. And then also how during the pandemic we've been thrust into embracing telemedicine, and how patients, in addition to healthcare professionals, have really had to do that. And I think Catherine also explained to us very well about how many patients, they don't actually want to come in to the outpatient any longer. They actually prefer to have the consultation with their advanced nurse practitioner post their cancer and during their cancer survivorship, to engage and do that using telemedicine. And then thirdly, I suppose, around leadership, and to circle back then to our opening session with Kathy Harvey in Oxford University, those qualities and those characteristics of leaders in good times and in bad. And Fergal O'Rourke also spoke to it very eloquently in terms of, you know, if you demonstrate in good times who you are, what your values are, and the culture within your organisation, that will carry you through to times such as this. But then also, if you behave in that way with values of compassion, of empathy, of authenticity and accountability during crises, well then that stands you in very good stead when we return to more normal times with our staff and colleagues and all our teams. So there were the main things for me, Mary.
It's the old adage, lead by example, care for your people.
Yeah.
What we're going to do is just end, because the symposium, by looking at the word cloud that we did earlier. We had 300 delegates who contributed to the word cloud. The symposium was on leadership. So these are the words that stuck out from that. It's very clear: empathy, honesty, communication, decisiveness, transparency, and they're what we need to abide by. Just to say, we would like to thank everybody who was involved in it, both the panelists, but also the number of people socially distanced here in our large lecture theatre who put on the production. Roche, our network partners, Ballywire production company. It was absolutely fantastic working with them. It made it seem all very seamless. So thank you to Paul and all the crew, and most especially to our UCD Smurfit school team, Beth, Adele and Paul, without whom this virtual gathering would not have been possible. And of course my colleagues in the Royal College of Physicians of Ireland. But to the four of us who pulled on people's time, Gerardine of course, Sinead, Knut, yeah, we were good at convincing people, and you see the high quality that we got. So thanks to everybody. Geraldine, over to you for the last word.
Thank you so much, Mary. So thank you for all those thank yous. So you've done half my job, so that's absolutely fantastic. So just want to say thank you to all who joined us this morning, to our delegates for tuning in, and to all our panel members and panel chairs who gave so graciously and generously of their time and energy, and for beginning our journey to de-silo and begin our cross-disciplinary conversation on how public health and business might forge ahead together to clear the runway, as it were, for our society and economy to thrive in the future. Our groundbreaking leadership network and inaugural conference is founded on the principle of bringing such diverse experts, as we have done this morning, together to engage in critical thinking as we seek to address the societal challenges facing our healthcare systems globally, and engage in foresight studies around the impact on health of all sectors within society and the economy. So a huge thank you to everyone, and as Mary said, a big thank you to Roche, our network partners who funded our technology here this morning, and to say stay safe and well, and slán live go léir.